Good morning, good afternoon. My name is Anvesha Bhagat, and I'm honored to be presenting my project on malaria, a disease that continues to affect millions globally, but especially in Nigeria. My presentation is Unmasking Malaria, Policy Gaps and Intervention Strategies in Nigeria. Through this, I'll explore how malaria spreads, challenges in Nigeria, and the prevention and intervention techniques that could save thousands of lives each year. But first, a little bit about me. I'm currently a rising junior at the Academy of Math, Science, and Engineering in New Jersey. This is my first year in the Global Health and Leadership Conference, and I'm really excited to be part of this global community. I'm involved in varsity tennis, I'm a trained Bharatanatyam dancer, and I hold a brown belt in karate. I also compete in varsity debate, and I'm an outreach officer for my school's Women in STEM club. In my community, I volunteer at both the New Jersey Food Bank and the Newark Beth Israel Hospital. Through these experiences, I've developed a strong passion for public health and medicine, and malaria stood out to me because it ties in both health equity and policies. So, what is malaria? Malaria is a life-threatening disease caused by parasites. It spreads through the bites of infective female Anopheles, mosquitoes, which are often active during the dusk and the dawn. Some risk factors include for the people who live in tropical and subtropical climates, much like Africa, children under 5 and pregnant women, and the genetic and socioeconomic factors also play a role, as people in rural areas often don't have access to prevention or treatment. The symptoms can seem much like the flu, for example, fever, chills, headaches, vomiting, abdominal pain, and fatigue, but often when it's untreated, malaria can quickly become severe or even fatal. So, how does the transmission work? When an infected female mosquito bites a person, it injects malaria parasites called sporozoites into their bloodstream. These sporozoites travel straight into the liver where they hide and multiply for about 7 to 10 days. During this time, the person doesn't feel sick. After leaving the liver, the parasites enter the red blood cells. Inside the cells, they grow and multiply until the cells burst, releasing more parasites. This is what often triggers the fever, chills, and other symptoms. This cycle repeats, making the person feel worse over time. Some parasites change into a special form called gametophytes. These don't cause symptoms, but they're important for spreading the disease. When another mosquito bites the infected person, it picks up those gametophytes through the blood. Inside the mosquitoes, the gametophytes turn into gametes, both male and female, which combine to form eukonites. These travel to the mosquito's gut wall, where they turn into oocytes. Each oocyte fills up with thousands of sporozoites, and when the oocyte bursts, it releases the sporozoites that travel into the mosquito's salivary glands. Now the mosquito is ready to infect the next person, and the cycle starts over. Disparities in Nigeria. According to the World Health Organization, Nigeria is accounted for 97% of the global malaria cases and 32 of the global malaria deaths in 2022. That's nearly 1 in 3 malaria deaths in the world occurring in a single country. Each year, Nigeria reports 68 million malaria cases, approximately 194,000 in deaths, primarily affecting children under 5 and pregnant women. Looking at the state levels, in Taraba State, the infection rate is 57.4%. In Zamfara, it's 54.4%. And in Kebbi, it's nearly 49 of the percent of people. And each have a high mortality rate. There are 4 major policy gaps holding back progress in Nigeria. First, funding. There's a lack of sustained government investment. Much of the current funding is short-term, focused on the treatment rather than prevention. Next, human resources. There's a shortage of trained healthcare workers, especially in the rural areas. Supply chains for medication and diagnostics are unreliable. 3. Health systems. Many rural clinics lack basic infrastructures. The training for healthcare providers is often limited and outdated. 4. Testing. Limited access to diagnostic test kits means that many cases go undetected or undiagnosed. These issues make it nearly impossible for Nigeria to respond quickly or effectively to outbreaks. At my work at the Georgetown University for Leadership Initiative Summer Program, my team and I were able to research malaria prevention and community protection. We found that even though individual prevention methods are important, community-wide prevention often has more benefits. When a large portion of the community is practicing the measures, it creates immunity and reduces the risk of transmission. As a result, we designed public health campaigns that would benefit the community of Nigeria, such as the mosquito repellent oil. Essential oil by the scent of peppermint is known to repel mosquitoes, so we concluded that the female Anopheles will not be attracted to the person. Also, we designed a game board for students ages 5 to 10, where we addressed the numerous misconceptions that are often placed because of religious and society taboos. Also, some prevention techniques include increase in long-term government funding, not just for treatment, but for education, prevention, and infrastructure. As a society, we need to scale up the public education campaigns to teach people how to identify early symptoms and seek help immediately. Even with decades of progress, millions of lives are still at risk each year, especially in children, pregnant women, and to rural families. To create change, we need more than just awareness. We need action. With an increase of AI technology, AI-powered predictive models can identify outbreaks are likely to happen weeks in advance by analyzing weather, travel, and mosquito breeding. Drones equipped with AI imaging can scan and identify mosquito breeding sites in remote villages, allowing for local teams to take action before the infection spread. With the right tools and the right leadership, AI can help bridge the gap between knowledge and action and save countless of lives. Here are some references. Thank you so much to Mr. Bailey for Leadership Initiative Summer Program, where I got to work with Nigerian leaders, and for the public health policies I got to learn. Thank you for the team, and thank you so much for the Global Health Conference for allowing me to present it.